Yes.
Okay. Okay. So today we discussed about bone marrow aspiration and we started with the introduction and definition. So bone marrow aspiration means it is a technique to obtain a small piece of bone for the purpose of diagnosing bone-related disorders such as aplastic anemia, metastatic, etc., etc. Then we discussed about indications for bone marrow. Some of the indications include hematological problems, cytopenias, then to stage the cancer, to see the response to the therapy, for investigation of unknown fevers, and to see other infectious problems. And then we discussed about contraindications. Some of the contraindications include if the patient has hemophilia, excessive thrombocytopenia, or uncooperative patients, or absence of aspiration site. Then we discussed common sites for aspiration. Common sites for adults and children. In case of adults, we have posterior iliac crest, anterior iliac crest, and sternal bone. In case of children, we have tibia bone, posterior iliac crest, and one more. What is it? Spinous process of the vertebrae. The same thing we saw: anterior, posterior iliac crest, sternum, then tibia bone on the upper portion of tibia. We can color for children, and we also discussed the spinous process of the vertebra. Then what are the three equipment or the needles we need for aspiration and biopsy? The needles are Salach needle, then Klima needle, and Jamshidi needle. What are the needles that are responsible for biopsy? Jamshidi, and other two needles for aspiration. What are the parts of this needle? So basic parts: it has a needle portion, then it has a stylet, it has an arbiter, and it has a cutting blade. Right? These are the parts of aspirating needle. Then we discussed about the procedure. Then we saw a quick summary of procedure, starting from the informed consent from the patient, site selection, local anesthesia, then performing the aspiration, then sample handling, and the post wound care. Right? So in the pre-procedure preparation, we have informed consent. We need to check his lab reports, including bleeding parameters such as BT, CT, APT, TT, TGT, then site selection. Then I emphasized about the significance of sterile protocols, including how to wear the PPE and how to remove the PPE. The last thing that you will wear in the PPE will be, that is called donning, that will be the gloves. Gloves will be the last thing you will wear in the complete sterile condition. The last thing you will remove will be masks. Very good. That is called doffing of PPE. Then we started discussing the actual procedure of bone marrow aspiration, that include patient positioning. We should keep the patient in prone position, and in the prone position, if we can't palpate the iliac crest, we can also ask the patient to be kept in supine position, where the knees are close to the chest and we can palpate the iliac crest. Then site identifying. We identify the site by the 5 finger palm method also. After site selection, we will mark the site. After marking the site, we went for skin preparation, where we cut the skin so that the needle can go through easily. After that, we given a, so we are giving local anesthesia before skin cut. I think there is a mistake here. There should be a local anesthesia first, after that skin cut. Okay, small error, keep in mind. Local anesthesia first, then skin cut. Okay, after that incision of the needle. After inserting the needle, when you are advancing, you will feel a popping sound. Popping sound or a giveaway. Giveaway means that indicates that the needle entered into the cortex of the bone. After needle entered to the cortex, we are removing the stellate, we are inserting a syringe, we are collecting the fluid portion of the bone marrow. Immediately we made the smears. After smear preparation, remove the needle and post wound care. Okay, so these are the major steps of bone marrow aspiration. Then we also saw few more things such as complication. Some of the complications post-procedural include infection, damage to the nearby organs or the components, and persistent pain in the patient. So this is all about bone marrow aspiration. Thank you so much for today.